It's my great pleasure, and thank you for being not on time. I lived too long in the UK, but now I go back to Germany, so this is not okay, guys. Sarah, just take your time, how long you want to speak, right? It's my great pleasure to have Sarah Caney here today, and the reason why it's my great pleasure is cat people always get very upset when we compare them to dog people, and actually I think we don't do justice. Obviously, cats, which used to be, but are very close to be still the most popular pet, are really important, and they are probably the ones which call you at night and wake you up having this condition. So having Sarah Caney here, who's a feline specialist, is a really great honor and pleasure, and I'm sure she gives you a different insight to what we heard earlier today. Please welcome Sarah.
Thank you very much, and I would like to start by saying it really was a great honour to be invited to speak at this meeting today, and I'm delighted to be here and really want to thank Purina and all of you for coming here. I saw in all of the marketing literature that went with today's meeting that it mentions neurologists and behaviourists, and of course I am, as has been pointed out, the imposter. So I'm here under a different specialty, feline medicine, and I hope that my perspective, from very much a clinician's perspective, will add to the weight of discussion that's happened so far today. And I've been very much enjoying my CPD in canine medicine. I am a dog owner, although I don't see any canine patients myself as a clinician. It's been really interesting. And of course there are many similarities between the canine situation and feline situation, although of course there are important differences as well. So it's been a great afternoon. And for any of you that don't know anything about me, this is just a sort of summary slide about me. Really the key things I wanted to particularly pick up on this slide were firstly that just from a professional perspective, I have my own business and website, vetprofessionals.com. I would love for you to visit the website and see what resources are there. There are resources aimed at the pet owner, also at clinicians, both vets and nurses, all really very much focused on feline topics by and large. And one of the things that I've done through my business is publish some books. The book covers shown on the slide, the most relevant one for today's presentation being Caring for an Elderly Cat, which I wrote with Vicky Halls, who is a very highly respected UK-based behaviourist, and that may be of interest to you as well. Holger also mentioned that he does some owner surveys, and that's something else which is a real passion of mine. So through my website, typically have several ongoing pet owner surveys running at any one time. And I would say that also for our surveys, we do get about 90 to 95% female participants, as was pointed out, and they are of a certain age as well, as has already been mentioned. So these typically highly committed people, very, very devoted pet owners, are willing to share a lot of information with us. And whilst that is a biased population, it's still, I think, a really great way of learning more about the pet owning experience. And that helps us as clinicians to do the best job that we can for our patients. So if we're talking about cognitive dysfunction syndrome in cats, I think a useful question to start off by asking is really, well, when should a cat be considered old? Because as we've already heard in the other presentations, this is an age-related condition. It's a condition that definitely increases massively in prevalence as our patients get older, whether they're dogs, cats, or indeed ourselves. And this table on this slide is one that was produced by the UK-based charity International Cat Care. icatcare.org is their website. And it's a nice summary of the different life stages of cats, as you can see, from kitten through to geriatrics in the left-hand side of that table, with the age of cat in the middle column. And then also I find really useful for owner discussions the human equivalent age in the right-hand column. And for older cats, really we're particularly talking about cats aged 11 years and over, the senior and what was called geriatric category, the 15 years and over category. iCat Care have recently renamed this category the super senior category because they felt a lot of cat owners didn't like the term geriatric. It had a negative connotation for them. So we have the seniors and super seniors, and they, unsurprisingly, are the ones that are most vulnerable to changes of cognitive dysfunction. And we don't have a lot of data, but some data that has indicated, as I've shown on here, how likely it is for a cat to have behavioural changes related to this syndrome. And as you can see, half of geriatric cats, those cats 15 years and over, estimated to have evidence of cognitive dysfunction. And you'll all know as well that we are, like with our canine patients, seeing more and more of our elderly cats as well. So this data is just a few years old and came from an organisation called SAVSnet, which is based in the UK through the University of Liverpool, but with a lot of collaborators. Basically is able to monitor what is happening in a number of practices that are signed up to be involved. It's more than 300. My eyesight, sadly, I can't read it. You might be able to read it. But you can see that the age distribution of patients coming into the clinic is shown on this slide. And just really wanted to point out that whilst, of course, we have fewer very old cats compared to very young cats coming into the clinic for a number of reasons, including the fact that as you can see, the age splits there as, we're showing each age group. But we are seeing more and more of these older cats. And certainly in the UK, it's really not at all noteworthy to see a 20 or 21-year-old cat. Whereas in the past that might have been considered exciting. Now, really, the cat has to be maybe 25 for it to get, much excitement from the clinical team seeing it in terms of its age. Fortunately for me, a lot has already been discussed about what we understand about the pathology, the pathogenesis of cognitive dysfunction syndrome in dogs primarily today, but there are certainly similarities with cats. This is not a particular area of my expertise. I've not been involved in any of the research that has been done, and there is less known about the feline situation than the canine situation, but certainly, as has already been discussed with dogs, a number of changes associated with aging and associated with cognitive dysfunction that we might see, including, for example, that beta amyloid accumulation, slightly different distribution in cats compared to dogs. Cats do get that hyperphosphorylated tau accumulation as well that was discussed. So a number of changes and a number of hypotheses in terms of what might influence that and exacerbate it. So any conditions that reduce oxygenation, that increase free radical damage, are also going to contribute to that as well. And also, as has been mentioned, in terms of recognition, there are a number of systems available for reminding us really of what clinical signs to look out for. And I have to be honest and say that the DISHA acronym is something that is only something I've recently come to hear about, because I'm very tunnel vision in my feline medicine, which I would say is a bit of a weakness. I'm not as good at reading up the other species information. But a lovely review paper that was published in the Journal of Feline Medicine and Surgery a few years ago, which I'll reference in just a moment, introduced introduced me to this acronym for recognition of cognitive dysfunction signs. And of course, as you'll know, very much developed initially thinking of cognitive dysfunction in dogs. And the very lovely Springer Spaniel there is actually our family dog, Spot, who is getting a little bit elderly. I think his cognitive function is reasonably okay at the moment, but he's thinking he's a cat because unfortunately he has hypertensive proteinuric renal disease, which just happened to be interests of mine, rather unfortunately, for poor him. But he is the sort of candidate, a 12, 13-year-old dog that we might be thinking of in our clinics for talking about these changes, as has been discussed earlier. And in the cats, very much applicable as well. So we still have the disorientation, altered interactions, the house soiling, altered sleep cycles, all those sorts of things, very much a feature there as well. So uppermost in our mind, particularly when we're seeing these older cats, is really to think about the sorts of changes that might be reported. Other signs often reported in our feline patients, altered grooming behaviour is often picked up in the owner history, particularly a reduction in grooming behaviour might be spotted by an owner. And the increased vocalisation, as Holger mentioned in his introduction, that really is something, I think often a frequent complaint by owners of elderly cats, that their sleep is disturbed in the middle of the night by this sort of very loud cat sounding like it's, in terrible agony or terrible distress in the middle of the night, vocalising and causing certainly a lot of owner distress. Altered appetite also recorded. And if we look at some of the published information, this is the review paper that I alluded to just a moment ago. So a really nice paper to read if you're wanting to understand more about cognitive dysfunction in cats. And you'll see that firstly from this paper, it referenced studies where there was information on what had prompted concern in the carer of the cat. So what was the sort of manifestation that perhaps prompted them to seek help? And firstly, we have actual behavioural referrals. So this slide just summarises some of the results in a number of cats aged over 10 years of age. And you can see house soiling was very much top of the list. It probably is one of the toughest things for an owner to live with, so that would be a good reason for it being top of the list, as well as it being not infrequently encountered in cats with cognitive dysfunction. Other changes on there, so we have a number of other behavioural changes, aggression between cats in the house, with people, the excessive vocalisation on there as well, and other things, as you can see. If we then looked in the same paper at what people were asking advice about, so perhaps not necessarily resulting in referral for maybe a number of reasons, but the sort of things that, again, carers were concerned about, you can see house soiling is still quite high up the list. It's number 2 now, but that excessive vocalisation, any of you that see cats as patients will know, really is a very common thing that will emerge in a history, and it is the sort of thing that often, I think, given an opportunity, owners will be very happy to share with you that, yes, this is a problem that they're seeing in their cat. But we do have, again, a number of other changes. So some of the disorientation, the cat that's maybe wandering aimlessly, appearing to have forgotten where it is or why it's there, looks a little bit lost, restlessness, irritability, aggression, fear or hiding, and the cats also that become very clingy, very over-attached to the owner and sort of follow the owner around and won't leave them. I mentioned that I do a number of surveys through my own website, and we have done a senior cat health and behaviour questionnaire, which is currently being submitted for publication, and I'd just like to share some of the results that we had through that with you. This is a survey that was open on our website, as you can see, for actually quite a long time, and it was open to carers of cats aged 12 years and over, and they were invited to complete no more than one questionnaire per household, but quite a long survey, 44 questions on health and behaviour. And of course, like all surveys, important to point out, the people discovered this survey primarily because they had previously visited my website, perhaps to buy a book or download other resources from there. So this was a sort of self-selecting population, if you like, of very dedicated owners of cats, as I've said, typically female owners, often middle to older age, but very, very dedicated. I would say often they're the people I would think of as my best clients, the people that really, really care and want to do the best for their cats. So we have a very low dropout rate for people starting the surveys. You know, they pretty much always complete it. And we were able to collect data from 863 UK households in this survey. Number of questions asked, as I've mentioned, covering health and behaviour, and also asking the carers to compare how their cats were now to when they were less than 12 years old. So what the sort of key changes that they could see in their cats. And just to run through some of that data very quickly, of course, bearing in mind that we don't know what other diagnoses or what diagnoses full stop are present in these cats, whether they are completely healthy, whether they have kidney disease, hypothyroidism, cognitive dysfunction or otherwise. It really is a very rough survey from that perspective. But nonetheless, I think it tells us something about old cat health. Firstly, we can see appetite changes. Well, many of the cats, their appetite wasn't reported to have changed, but just under a quarter were eating a bit less, just under a quarter were eating a bit more than normal. So perhaps, hypothyroidism would be one reason for eating more, for example. More cats in terms of thirst changes, drinking more, so conditions like kidney disease, thyroid disease, diabetes, of course, more common in these older cats and may have accounted for that. Time spent grooming, I mentioned earlier on, that's something that can be affected in cats with cognitive dysfunction, and we actually saw quite a number of cats in this survey. The owners reported about a third of their cats were grooming much less than they had done when younger. Sleeping, well, many of them described as sleeping a lot more, just a very small number spending less time sleeping. We didn't ask more about daytime versus nighttime sleeping also. Time spent outdoors, many of the cats venturing outdoors much less. Again, we don't know more than that. More than 80% of the cats in households participating had access to a litter box, but in spite of this availability, a quarter of the cats were reported to have some toileting accidents involving either urine or faeces or both. So again, toileting accidents quite commonly seen in this group of cats. We also asked about their interactions, so interactions with other animals, whether that had changed, and 23% reported they were more intolerant. A smaller number seemed to be more sociable, so some variation there. Social interactions with people, more common for, if there was a change, for it to be that the cat was more affectionate, more clingy, particularly with their owner. And increased vocalization, already picked out as a common thread in these sorts of cases. Well, more than half of the cats had shown signs of increased vocalization, with nighttime vocalization present in about a third of the cats. We did ask some other health questions. Again, we don't know for each cat actually what their health status is, so it just gives us a picture of really the cat, for example, whether it was visiting a vet clinic, what sort of monitoring it was having, and you can see again probably another reflection that these are dedicated owners that are taking their cats into the clinic quite often. So we could see that actually 2/3 of the cats had their routine vaccinations, which is definitely, I think, higher than the sort of global average for that. About 3/4 of the cats had presented to their vet within the last year for reasons other than vaccinations. So whether that was a wellness evaluation or whether it was because the cat had a clinical problem, we don't know. But again, evidence that they were having the cats seen and assessed. And actually a lot of the owners did know what the cats weighed. So again, other evidence that they really know a lot about their cat. They're doing a lot for their cat. And as you can see, the main change, if there was one, was for weight loss, which again won't come as a surprise. So 38% perceived their cat to have lost weight, a very small number reported weight gain. Many of these cats had blood and urinalysis performed, and urinalysis certainly in the UK is still underperformed. So the fact that 38.8% of these cats had a urinalysis, again, really I think tells us that the sort of people that were participating in this study are, very, very top level clients who will do whatever the vet recommends, but possibly also be more proactive than that and go in and actually request examinations and assessments as well. And as you can see, a number of these people were doing wellness evaluations. So about 40% described as routine, and the remainder being when the cat actually was presented because of a clinical problem. And again, blood pressure assessment, something else that is still underperformed in this population of cats. Not so bad compared to, I think, what would be otherwise a guess of how frequently this was performed. So being done in nearly 30% of the cases and reported to be a high in about 1/4 of the cats where a measurement was taken. So what's this tell us? Well, of course, it only tells us a little bit of the story. It does tell us, though, that it is common for behaviour and health changes to occur in older cats. We don't know for this group of cats in the household exactly the reasons behind that, but we do know that a number of conditions are common in older cats. Cognitive dysfunction is one, but of course many other conditions that are very common, and very commonly of course, we will then have multiple conditions present in the same patient. So kidney disease, hypothyroidism, cognitive dysfunction, hypertension, can all very, very easily happen in the same cat. So where can we make an impact in terms of cognitive dysfunction? What can we do to be better clinicians here? Well, I think we need to pay more attention in general, and this may not apply to the people in this room, particularly the behaviourists here, because you will already be doing, of course, behavioural histories as part of your examination. But for many GP vets, it's perhaps not always the top of their list of priorities when they see a patient, particularly if it's come in for a routine examination, for example, a vaccination. It may not necessarily cross the vet's radar that this is the time, this perhaps is the only time in this next year when I can assess this patient in detail. So I must make sure that I cover all the important things that are required for the older cat. And a behavioural history is definitely one of those. I have a senior cat healthcare questionnaire which you can download from my website. There's a section called Helpful Info, and then if you look down there to the free downloads, there's a number of technical documents, and the pictures here are just snapshots from my questionnaire. Now, it's not a behavioural focused questionnaire. It definitely could be improved, and any constructive criticism always appreciated. But it contains, firstly, on the left-hand side, general health questions, a reminder really to make sure that either the vet or nurse, whoever's leading the consultation, remembers to ask all the sort of pertinent health questions. So it's sort of, have you noticed any change in your cat's ... And we've got, thirst, appetite, eating, etc. there. So hopefully prompting people to say, whether they've spotted anything and just reminding them what maybe to consider there. And of course, if it's all no, then when it comes to actually doing the consultation, because this is something that an owner can fill in the waiting room, if everything looks fine, you can be, quite efficient in your consultation, shall we say. But if there are areas where the owner has said, yes, there has been a change, there are things you need to follow up on. And the questions on the right-hand side actually do have an overlap with cognitive dysfunction, but primarily when I wrote was thinking about mobility and osteoarthritis as another underdiagnosed and undermanaged condition that's common in the older cats. And so questions here need to be very careful because, as you all know, osteoarthritis in cats we often find difficult to identify because cats primarily make lifestyle changes to compensate and cope for any chronic pain they're having. So, and because these changes often are very gradual, they may be difficult for a carer to notice. So, for example, the cat that used to perhaps love going upstairs in the house and sleeping on your bed upstairs may now start to sleep downstairs because it finds going up the stairs difficult, or it may now sleep on a mat by the door because it doesn't want to jump because jumping is painful. But until we ask these questions actually, and indeed often actually when I first ask these questions, many carers will say, oh no, that my cat's absolutely fine in terms of their ability to get around. They love running down the garden or climbing the tree or sitting on the kitchen windowsill, or I have to put the food away because otherwise the cat will jump on the table and might eat my food. All these sorts of little anecdotes will come out, but then when they go home and actually watch the cat more closely, having been asked this series of questions, which includes looking at the sort of tasks or activities that the cat might previously have done, they then will start to look more closely, and often on the next visit will come back and say, oh yes, my cat actually, it doesn't jump on the table anymore, even if I leave its favourite food out. So clearly mobility has changed. Some of the questions in the mobility survey here also relate to chronic pain, which can very much impact on behaviour and interactions. So there's a little bit of overlap with some of the sort of clinical signs we might see with cognitive dysfunction compared to pain related to osteoarthritis. So we need to be careful in terms of our interpretation of this, but it can be useful. So for example, is your cat more grumpy or less happy being handled, or does it dislike being picked up, or has it changed where it sleeps? All those sorts of things could be impacted by cognitive dysfunction as well as by pain related to osteoarthritis. So asking the questions definitely helps, and again reminding ourselves of what the sort of things that we might come to expect in a cat that does have cognitive problems. And I think the more we can do to just make it a normal part of our discussions, many people are increasingly better educated when it comes to age-related brain disease in people in themselves. So everyone has heard of Alzheimer's disease. Everyone probably knows someone who has had dementia or Alzheimer's disease. So they have an idea of what to expect, and just with a little bit of discussion can then extrapolate to understanding what it might mean for their cat. So asking the questions and finding out, how is the cat's behaviour with you? Has it changed with the other cats or yourselves? Is your cat more clingy or more irritable, more anxious? Actually getting them to open up about all these things. Has their sleep behaviour changed? Have you had any increase in vocalization in your cat? Can all help to identify these sorts of issues. Physical examination, well, many of these patients, if they do have cognitive dysfunction and if it is severe, remember that a vet visit, which is always stressful for a cat, even if you really do everything you can to reduce the impact of that stress, is going to be heightened in a cat with cognitive dysfunction that may feel very confused and very unhappy at being taken from its normal environment, where perhaps it feels some sense of security, to a very unfamiliar environment where there may be additional stressors which they have heightened responsiveness and difficulties in coping with. So noise, smell, all the sort of vet visit features really may be very difficult for the cat to cope with. Also combined with if they do have any osteoarthritis, any chronic painful conditions, any hearing or visual deficits, the physical examination, the handling, also becomes that bit more stressful and difficult for the cat. Sorts of changes that we might look for might include a poor coat if the cat is grooming less, the overgrown nails, very common in the elderly cats that are less active and less likely to be stropping and scratching their claws to wear them down. So that may give us some clues, but we also, of course, need to do our really, really thorough physical examination to look for all those sort of common comorbidities, but also things that can lead to similar clinical signs. So, of course, all the causes of chronic pain, whether that's dental disease or arthritis, high blood pressure, which can also cause a hypertensive encephalopathy, and signs of dementia. We need to do our really thorough examination to make sure we rule all of these things out. And definitely not a complete list of differential diagnoses, but this is the sort of list of differential diagnoses that I would be considering in my patients, that may have an impact on behaviour or some of the other clinical signs for a number of reasons. So common things to consider would definitely include the high blood pressure that I've already mentioned, of course hypothyroidism. Good thing about both of these is, of course, that there are things we can do to manage, to treat these conditions. So, of course, that it makes it even better to look for them and hopefully identify something that is manageable. And even if it's not the whole answer, that might provide some improvement in clinical status. We've also heard through other speakers today talking about dogs, about other differentials, so hepatic encephalopathy, liver disease, of course brain tumours. Cats are quite good at getting meningiomas that can be quite huge and can be treatable if an owner is happy to go for a referral to a neurosurgeon for management of that. Lower urinary tract disease, of course, is really a common problem in cats in general. In older cats, we also very much want to consider bacterial infection because they're more vulnerable to bacterial urinary tract infections. And those also can, of course, lead to the house soiling accident, so periuria. Equally, any cat that is polydipsic and polyuric is going to be more vulnerable to those sort of house soiling accidents. So we need to really look in a very holistic fashion at the cat and try and work out, well, for example, if house soiling is the problem, is it, for a mobility reason that the cat can't get to its normal toileting location? Is it because it is polyuric, polydipsic, or has a urinary tract infection? Is it because of cognitive dysfunction? So an awful lot of different differentials, and a few more at the bottom there as well. So our assessment does need to be, I think, very general, very open-minded at the start, because particularly if you're seeing a cat aged 15 or over, it will absolutely be guaranteed, I think, to have at least one old cat condition. It has, for example, been estimated that, a couple of studies have estimated that more than 90% of cats over the age of about 12 have radiographic evidence of osteoarthritis. The radiographic picture doesn't always correlate 100% with the clinical picture, but clearly you would expect very, very common for cats to have OA. At least a third of these elderly cats are going to have chronic kidney disease. So, very, very common to have these comorbidities. So we need to do really as detailed a history and physical examination so that we can look for as many clues as possible in our investigations. The clinic that I visit has, from a mobility assessment perspective, they have built some little steps in the side of the clinic wall, which I must admit, when I first saw, I thought, is this really useful or a gimmick, or perhaps just somewhere to put your bag or for the client to sit or their children to sit. But we weigh the cats at the top of the steps on a work surface there, and actually the elderly cats all pretty much just choose to trot down the steps. And whilst I've only had, I think, 2 cats ever that I've been able to persuade to go up the steps, we do at least get some mobility examination in the consulting room. But more importantly, actually, it opens the discussion of mobility with the owner. So it really emphasises them. We're worried about mobility in older cats, and this is what you can look out for at home. There are things we can do to help your cat. So anything we can do, I think, to increase that awareness is a good thing. We also, very much important in our physical examinations, the first hands-on thing to do would be to assess blood pressure. And cats, as you'll know, are very vulnerable to this white coat, or what's now called situational hypertension. This is the cat that isn't hypertensive, but if you put it in a stressful place, its blood pressure can transiently increase quite dramatically, and we don't want to misdiagnose that cat as being hypertensive. So we want to do firstly blood pressure assessment as the first part of our examination before we've wound up the cat through any other procedures. Do it in as calm and gentle a way as possible, and examine the cat for evidence of target organ damage, particularly the eyes, which may help you to confirm that diagnosis. If you have a high reading and the cat also has retinal hemorrhage, for example, then that confirms the diagnosis of hypertension. But if the eyes look normal and you've just got one high reading, we should be careful about to not diagnose hypertension too quickly, because that cat could be one of these stress hypertensives. So a number of things we want to do in our physical examination, but also from a laboratory perspective, definitely as a minimum, really I would want to do my haematology, biochemistry, urinalysis, ideally including a total T4 from the start, but if cost prohibits that, then looking very closely at the liver enzymes. If they're elevated, definitely run a T4 test as my next test, because hypothyroidism affects about 10% of elderly cats. So it is another common and important cause of behavioural changes in that older cat. We might want to consider, depending on the presentation of the cat and the remainder of its history, infectious disease testing, because infectious diseases certainly can affect the central nervous system and cause behavioural changes. But many of these conditions are less commonly seen in your sort of elderly cat. They're more young cat conditions, particularly FIP typically, but not always. So they're very much still on the list of differentials. And then beyond that, really, I think there's many things that are an advantage if possible, but a bit like the earlier presentation where talking about dogs and imaging being absolutely the ideal where possible, but owners not always wishing to do this because it does require sedation or anaesthesia. I very much find the same in my cats as well, particularly if you have a slightly fragile elderly cat, and perhaps it's come in for its vaccination, rather than the owner primarily having big concerns about the cat's behavioural changes, then I often find the owners are less keen to go for advanced diagnostics if they require sedation, because they quite understandably feel very protective of their cat and worried about its ability to cope with procedures or the stress associated with that. But depending on the cat and what differential diagnoses you might still wish to rule out, there is potentially quite a long list of investigations that might be helpful. So then finally, what about management of cognitive dysfunction in cats? What can I tell you there? Well, I think my main tips would be really remember that you're dealing with an individual cat and owner, and always look to really focus on what that individual cat's concerns are, and the owner concerns as well, as to how you prioritise your management. Look to do as detailed a general health assessment as you can. So all the things I mentioned, from a physical examination, the history, and that minimum database of blood and urinalysis, really I think is essential, because that will give you quite a detailed set of information in terms of that cat's general health, whether or not you have a cat that has renal disease, thyroid disease, etc., and therefore what management is appropriate, perhaps in addition to general strategies for cognitive dysfunction. We also need to educate the owners and support the owners, and I think this is getting maybe a little bit easier because of increasing awareness of Alzheimer's and other causes of dementia in people, but really to talk through what we understand about this condition, and that unfortunately it is likely to be progressive, so we need to be realistic about what can be achieved. Really the best that we're aiming for is often stabilising the patient and maintaining quality of life, rather than being able to really turn the clock back. I'm a big believer in environmental enrichment as well, and that's been mentioned on the dog side. I've got some similar comments on the cat side. There are, of course, nutritional interventions, which we can mention as well, and lastly, some pharmaceutical interventions as well. Much less known on many of these things than is the case for dogs, so we're still relatively early in many ways. So environmental enrichment, I think, is really important, and all of you that are behaviourists here, really, you will know this very, very thoroughly already. But my approach very much is to make life as supported and enriched as possible for all of my patients at all of stages of their life. But when you come to think of cognitive function, it's really supporting that cat to maintain its brain function. We want to make sure that the cat has access to the key resources, and that access is easy, it's readily available, that even if the cat has, let's say, memory or training sort of issues, that even if it thinks, I don't know what a litter tray is, if it's actually has one within eyesight, hopefully it's going to favour there as a toileting location rather than perhaps the mat on the floor or whatever other substrates are available. Try and keep a daily routine, try and make things interactive and stimulating if the cat will appreciate that. So things like these innovative feeding solutions that I've shown a picture of little mice that you can hide the cat food in, and the cat has to play with the mouse and discover it. Depending on the severity of cognitive decline, these sort of things can be worthwhile for the cats as well. And then from a mobility perspective and general old cat support, having a low bed that the cat can walk on and walk off. I leave a heated pad underneath that fluffy mat so that it's always warm and soft and comfortable for the cat. Consider raising food and water bowls, because many of these elderly cats do have arthritic spines, elbows, shoulders, that mean crouching down can be potentially quite uncomfortable. So just lifting the food or water bowl up can definitely help there. Making it easier for them to get to places that they want to get to, whether that's on top of the bed or perhaps the sofa or other places, little stools, steps or other options. If the cat has previously toileted always outside and the access outside is through a cat flap, bear in mind again that the cat with mobility problems may just find a cat flap is quite tricky really to navigate, and if you're a bit sore you may not want to do that. So you may wish to just now supervise your cat outside or leave the door open if the weather allows. Try and make life stimulating through toys, feeding, as we've talked about. So catnip, if your cat likes it, is often popular there. And as an absolute must, make sure that the cat does have a litter box offered to it. So it has this available, and also what I would call the sort of optimum litter box scenario, which means a large roomy litter tray, so the cat has plenty of space to move around in, that has a low access point ideally, so that it's easy for the cat, even with arthritis, to step in and step out, and a nice soft litter to stand on. So a sandy clumping litter is generally the favourite for most cats. Also is easy one to see if the cat has used, easy to keep clean, and very much what the cat would prefer. So avoid the sort of covered litter trays, avoid litter tray liners, avoid the perfumed litters. These are all things that are designed for owners rather than cats, and make sure that the cat has access to these litter boxes wherever they go. For very badly affected cats, it may actually be something to do maybe to shrink their environment, if you like, particularly when you're out of the house as a carer. If you find your cat is very anxious on its own, create a new room, maybe the spare room, which becomes the cat's room. It has all of the cat's essential resources there. Maybe consider things like Feliway, the synthetic feline facial pheromone preparation, to help transmit or communicate that feeling of reassurance in the environment. Pet Remedy also quite popular. I don't think any published studies on cats with Pet Remedy. This is a product that contains various herbs, including valerian and vetiver and sage, that thought to mimic GABA and produce a calming effect. So may also be of some interest or some help. And of course, nutraceuticals as well that exist that have anxiety alleviating or stress alleviating impacts as well. So these may be of some help. There has been some research on diets and cognitive dysfunction. Again, this is not a particular area of expertise for me, but a number of modifications have been looked at on the canine and feline situation to try and produce a diet high in antioxidants and which really supports brain function. And you're going to hear more, I think, about the canine situation a little bit later on. But safe to say that there are some studies, a small number of studies, that have found some benefits with dietary modification, which I think is not a surprise based on what we've already heard earlier today as well. So, for example, SAMI, which provides glutathione, has been shown to be beneficial in some cats in early stages of cognitive dysfunction, as have other things as shown here. So there's a little bit of data that's certainly starting to emerge. There's definitely hope on the horizon that dietary modification may be a useful adjunctive management for these cats as well. And there are some medications that have been mentioned in the canine situation. There isn't anything published to my knowledge really other than, sort of anecdote and experience on these. And I will confess I've not used these myself, but selegiline and propentophyline have been used as possibilities in cats with cognitive dysfunction. So there are some protocols, and I'm sorry I've run out of time to sort of flash through these, but if you do want a PDF of my slides, you're very welcome to ask me. And then very finally, I just thought I'd put in a little bit more on the nighttime vocalization, because this is such a big concern for many owners. A survey that Vicky Halls did actually quite a long time ago, one of the things she asked in this larger owner survey, I think more than 1,000 owners contributed to this, was at what age they spotted this in their cats. And this graph shows the results. The cats in the left-hand column were ones that were always chatty, which is why they're age 0, have that bar up the left. But for the other cats, you can see that it's, as they reach 10, 11, that sort of age where this starts to appear as a problem. And it is something that I think often is a reason for owners to coming into the clinic and asking for advice. And again, really my starting approach is to rule out particularly all the things which have a management that may have a benefit on that cat. So make sure we check for thyroid disease, hypertension, consider other possibilities there as well. And then really from an owner perspective, it's really that support, advice, education, and then making sure environmentally that the cat has plenty of stimulation in the daytime, so that hopefully it has a rewarding and fulfilling existence when the owner is up and awake. But then at night time, consider having a bedtime routine, which allows the owner to get some sleep, because many of these carers really are having, as difficult a time as you might as a parent with a newborn baby, very, very interrupted nighttime sleep, and you're very worried about your cat. So what was suggested to me by Vicky Halls several years ago, and which is a strategy I've successfully employed, is summarised on here. So you, again, create your separate cat room for the cat that has everything that the cat might need, so all its key resources that it can get to, so a nice litter tray, a nice bed, at levels, floor level, so the cat can easily get on and get off, for example. The food, the water, everything is really within eyesight of the cat. It will always be able to see and appreciate it has these resources. Perhaps have your Feliway and or Pet Remedy there as calming, soothing presences as well. Perhaps consider those nutraceuticals. But the main thing is you have a different bedtime routine. So when you go to bed, you then have your bedtime routine with your cat, and a bit like being your bedtime story for your child. It's right, let's go to your room now, brush your teeth, perhaps not. Have a nice little treat. This is your bedtime treat from me, and I'm going to give you a kiss, and I'm going to say night-night, and then I'm going to close the door, and I go to bed, and I put earplugs in for a few nights, or I go away for a few days, and I let my other half, who's perhaps less attached to the cat, go through a few days of loud noises. But ultimately, many cats, actually within a few days, will come to learn that, okay, this is where I go to have my nighttime, and if I meow, no one hears me, so I stop meowing after a while. Of course, the worst thing is the intermittent reward, so don't do that. So it can be successful. I don't think I'll play the video because it really is just a cat yowling, and you're all very familiar with that, but it can be a successful strategy for cats like Kamala. And I don't want to keep you any longer than you have to, so I'm just going to finish by saying we all know it's a big problem, and the challenges are really making sure that the owners understand it's an important problem to talk to us about, so making sure we ask the right questions, and knowing that there are things that we can do to support these cats, whether that's managing the comorbidities or helping in terms of the cat's environment. So thank you very much for your patience, and I'm sorry for running over on the time front.
Sarah.
Pleasure.